anti-cancer preparation NSC 631570, Ukrain, in the treatment of malignant pancreatic tissue, by Dr. Vasil Novitsky of Novitsky Pharma, the Ukrainian Anti-Cancer Institute, Vienna, Austria, and Nicola Funel, PhD, of the University of Pisa, Italy. Today, pancreatic cancer remains one of the most fatal cancer types. According to estimates from Globocan in 2012, more than 331,000 people die every year due to pancreatic cancer. The highest incidences of the disease are found in developed countries. With an overall 5-year survival rate of about 6%, ranging from 2 to 9%, pancreatic cancer remains a medical challenge. Once symptoms develop, the chance for surgery is only about 20%. It is estimated that pancreatic ductal adenocarcinoma, PDAC, will become the second leading cause of cancer-related deaths by 2030. The mean age for the onset of PDAC is 70 years old. At the time of diagnosis, only 15 to 20% of patients are in the stage of operable disease. Mostly, patients present themselves for the first time with an unresectable disease, making chemotherapy the most important treatment option. Therefore, gemcitabine is the standard treatment with a response rate of only 5 to 10% and an average median overall survival of 6 months. The tumour has a high resistance to chemotherapeutic agents. Current treatment of PDAC. As of the 1950s, fluorouracil-based chemotherapy was the main treatment option for pancreatic adenocarcinoma, with a mean survival of less than 6 months. Attempts to combine 5-FU with other chemotherapeutics, such as doxorubicin, mitomycin C, cyclophosphamide, methotrexate, vincristine, and cisplatin, increased toxicities failed to improve survival rates. Gemcitabine was the first chemotherapeutic drug that showed superior results to 5-FU in terms of overall survival. Gemcitabine-treated patients showed a statistically better median overall survival of 5.65 versus 4.41 months, and overall 1-year survival rate 18% versus 2%. However, these results remain unsatisfactory. Incredible results of the treatment of pancreatic cancer were achieved during clinical research studies with NSC 631570, Ukrain, carried out by Associate Professor Gansauge and Professor Hans Beger in Germany. They showed that 30% of pancreatic cancer patients lived more than 5 years after treatment with Ukrain, while medical statistics show that after conventional treatment methods, patients with the same diagnosis live only 4 to 6 months, and only 2.2% of them reach the 5-year survival rate. This can be found in the protocol from the 19th of October 2012 on the Ukrain.com website, in which Associate Professor Gansauge from the University of Ulm, who had carried out numerous clinical studies with pancreatic cancer, answered the question, were patients completely cured, with no, not with the palliative patients. With the adjuvant patients, there was around 30% who lived for 5 years. NSC 631570, Ukrain, is an anti-cancer agent created on the basis of alkaloids from the plant Chelidonium myas L. Ukrain has been used for cancer treatment for more than 40 years. Monotherapy and combined application of NSC 631570 have been successfully used for the treatment of malignant melanoma since 1996. Here we see the results of a study of Ukrain carried out at the National Cancer Institute, Bethesda, Maryland, USA. It shows a comparison of the cytotoxicity of Ukrain and 5-fluorouracil against different cancer cell lines. We see the results for Ukrain in red and those for 5FU in blue. As we see, the Ukrain effect goes almost down to 100% loss of cell biomass, whereas 5FU comes down only as far as growth inhibition. PDAC under Ukrain treatment, in vitro studies. Pancreatic cancer cells retain the epithelial-related phenotype and modify mitotic spindle microtubules after the administration of Ukrain in vitro, by Galliano et al. The effects of Ukrain were examined on pancreatic ductal adenocarcinoma cells in relation to the expression of epithelial to mesenchymal transition, EMT markers. 3 cell lines, HPAF2, HPAC and PL45, were treated with Ukrain at 5, 10 and 20 micromole per litre for 48 hours or left untreated as the control. The EMT markers E-cadherin, beta-catenin and vimentin, as well as actin and tubulin cycloskeletons were analysed. Interphase and mitotic microtubules, as well as abnormal mitotic figures, were studied by fluorescence microscopy after tubulin immunolabeling. Results: Ukrain strongly suppressed cell proliferation and induced apoptosis, possibly through an extrinsic pathway, as cytochrome C immunoreactivity suggested that the integrity of the mitochondria was not affected. Tubulin expression indicated an anti-proliferative effect of Ukrain on the basis of alterations in mitotic spindle microtubule dynamics leading to abnormal mitosis. Membranous E-cadherin, beta-catenin immunoreactivity was similarly expressed in control-treated and Ukrain-treated cells, although the drug upregulated E-cadherin in cell lysates. Results suggest that Ukrain exerts its chemotherapeutic action on PDAC cells, targeting mitotic spindle microtubules, leading to abnormal mitosis and apoptosis, and favouring cell cohesiveness. More in vitro studies of PDAC under the treatment of Ukrain. NSC 631570 affects pancreas cancer cell phenotype in vitro by targeting MMP9 and intra-extracellular spark expression. Nicola Finel et al. The effect of Ukrain on the expression of some of the key markers of tumour progression in pancreatic cell carcinoma was investigated. 3 cell lines, HPAF2, PL45, HPAC, were treated with Ukrain at 5, 10 and 20 micrograms for 48 hours or left untreated. Secreted protein acidic and rich in cysteine, SPARC, mRNA levels were assessed by real-time PCR. Matrix metalloproteinases MMP2 and 9 activity was analysed by SDS zymography. SPARC protein levels in cell lysates and supernatants were determined by Western blot. Cell cycle was determined by flow cytometric analysis and invasion by matrigel invasion assay. Here we see the graph showing the effect of Ukrain on the invasive potential of HPAF2 cells. Cells on the lower surface of the filter were fixed and counted 48 hours after Ukrain administration. And here, the graph shows the changes in cell cycle phase distribution after Ukrain treatment of HPAF2 cells. Results: NSC 631570 downregulated MMP2 and MMP9. SPARC protein downregulation in supernatants points to an inhibition by Ukrain of extracellular matrix remodeling in the tumour microenvironment. At the same time, SPARC, mRNA, and cellular protein level upregulation suggests that Ukrain can affect cell proliferation by cell cycle inhibition. Ukrain-treated cells showed a cell cycle G2M arrest. PDAC under the treatment of Ukrain. Case reports. Treatment of pancreatic cancer patients with Ukrain. 4 case reports by Gansauge. 4 advanced pancreatic cancer patients who had exhausted all conventional methods of therapy were treated with Ukrain and gemcitabine. The status of all 4 patients has improved. Clinical signs of partial remission were observed. Treatment was performed on an outpatient basis, allowing patients to work and have a good quality of life, neither of which are normal in this category of cancer patients. No severe side effects of the treatment with Ukrain have occurred. More case reports. A retrospective study of Ukrain treatment in 28 patients with unresectable pancreatic cancer by Ashoff. In this study, 28 patients, 17 male, 11 female, aged 48 to 74 years old, with a mean age of 49.8 years, with advanced and/or metastatic pancreatic adenocarcinoma, were treated with Ukrain. Ukrain was administered at a dose of 20 milligrams 3 times a week for the first 3 months, total 3-month dose 720 milligrams, then 20 milligrams once a week for 4 months, with a total dose of 320 milligrams. NSC 631570 Ukrain was generally well tolerated. Partial remission was achieved in 24 cases, 85.7%. There was no response to treatment in 4 patients, 14.3%, and 24 patients noted an improvement in their quality of life during Ukrain treatment. Mean survival of the patients, 26.1 months after start of Ukrain therapy. Another case report on Ukrain in the therapy of advanced metastatic pancreatic cancer in a female patient aged 47 in a grave general condition with marked decreased performance, jaundice, nausea, vomiting. She was diagnosed with pancreatic head carcinoma, T4N2M1, and peritoneal, parietal, and visceral carcinomatosis, leading to large intestine compression. Numerous metastases were revealed, and the following operations were performed. Treatment with Ukrain with 10 milligrams twice a week in combination with ascorbic acid solution was started, receiving 250 milligrams altogether. General performance status improved considerably. Appetite increased, jaundice and nausea slowly disappeared. Serum cancer markers and blood count improved. After second course of Ukrain, patient felt free of symptoms for a period of 16 months. Survival was more than 5 years after original diagnosis of advanced pancreatic cancer. More case reports. Ukrain stimulates fibrotic and sclerotic transformations of pancreatic cancer tissue. Comparative description of 6 cases. The study was performed to investigate histological changes of pancreatic ductal adenocarcinoma after Ukrain administration. 6 non-smoking male patients with histologically verified ductal adenocarcinoma took part. All patients had received palliative surgical treatment followed by chemotherapy with gemcitabine and 5-fluorouracil. Due to adverse events, chemotherapy was discontinued, and 30 milligrams Ukrain weekly, 120 milligrams per course, was started with the last injection 10 to 12 hours before surgery. The results. Necrotic area squares were found to have increased by 50 to 70%. Perivascular sclerosis was found. Microcirculation disorders, tissue infiltration with blood, connective tissue disaggregation, and pathological changes to vascular walls. Fibrinoid infiltration leading to encapsulation of cancer cells were found in the cancerous tissue after Ukrain administration. Clinical research of PDAC under the treatment of Ukrain. Ukrain in the palliative treatment of pancreatic cancer. Results of a Phase 2 trial by Gansauge et al. 90 patients with histologically proven unresectable pancreatic cancer were randomized in a monocentric controlled randomized study. Patients in Arm A received 1,000 milligrams gemcitabine per square meter. Arm B received 20 milligrams Ukrain, and Arm C received 1,000 milligrams gemcitabine per square meter, followed by 20 milligrams Ukrain weekly. The endpoint of the study was overall survival. The results. In all three arms, therapy was well tolerated and toxicity was moderate. Median survival, according to Kaplan-Meier analysis, was in Arm A 5.2 months, in Arm B 7.9 months, and Arm C 10.4 months. Actuarial survival rates after 6 months were 26%, 65%, and 74% in Arms A, B, and C, respectively. Ukrain alone, and in combination with gemcitabine, nearly doubled the median survival times in patients suffering from advanced pancreatic cancer. Another study by Gansauge et al. Looked at the clinical efficacy of adjuvant systemic chemotherapy with gemcitabine and Ukrain in advanced pancreatic cancer. The aim of the study was to determine the effectiveness of combined treatment with gemcitabine and Ukrain in the adjuvant treatment of resected advanced pancreatic cancer. 30 patients received adjuvant chemotherapy following surgical resection for pancreatic cancer. Chemotherapy consisted of gemcitabine, according to the Burris protocol, with weekly infusions of 1,000 milligrams per square meter. Immediately following gemcitabine infusion, 20 milligrams of Ukrain were administered intravenously over 15 minutes. The results. The actuarial survival rates were 86.7% after 1 year, 76.6% after 2 years, 46.7% after 3 years, and 23.3% after 5 years. The median survival time, according to Kaplan-Meier regression analysis, was 33.8 months. The study showed that a combination of gemcitabine and Ukrain is a safe treatment and leads to prolonged survival. Zemskov et al. Also studied Ukrain in the treatment of pancreas cancer. 42 patients with advanced symptomatic pancreas cancer were randomly assigned to receive either vitamin C, 5.4 grams every second day, repeated 10 times, and Ukrain, 10 milligrams every second day, repeated 10 times, 21 patients, or vitamin C, 5.4 grams every second day, 10 times, and normal saline, 10 milliliters, for the control group of 21 patients. The primary measure of efficacy was overall survival. The results. The 1-year survival was 81% in the Ukrain group compared to 14% in the control group. The 2-year survival was 43% in the Ukrain group compared to 5% in the control group. Median survival was 17.17 months for Ukrain-treated patients and 6.97 months for the control group. Mean survival was 21.86 and 8.92 months for the Ukrain and control groups respectively. Here we see the inhibition of capillary sprouting by Ukrain in endothelial spheroids model. To the left with 20 micrograms per milliliter of Ukrain, and to the right with 50 micrograms per milliliter. Unresectable pancreas cancer in a 62-year-old male. Pancreatic adenocarcinoma. Preoperative treatment with Ukrain, total 100 milligrams, 10 days prior to surgery. Pancreaticoduodenectomy. Necrosis of tumor tissue A. Inhibition of new vessels formation, defect in capillary wall, defect in endothelial covering, and B. Here in the same patient we see nuclear changes. In A, chromatin dispersion, and in B, fragmentation, and C, hydropic cytoplasm degeneration. If you have any questions or would like to contact us, please see our email addresses here on the screen. Dr. Vasil Novitsky at dr.novitsky@yahoo.de and Nicola Funel, PhD, at nicola.funel@gmail.com. Thank you, ladies and gentlemen.